Ladies and gentlemen, now I'm going to show you how and where to guasa for neck pain and shoulder pain. When the neck area are painful, it is closely related to the shoulder as well. Guasa treatment are very effective for such problem, and when you guasa the painful area, you will see the effect very fast. For painful neck and shoulder, you must guasa the backbone at the neck first and followed by the shoulder. This is the neck area plus the backbone area that you must do the guasa, including the shoulder. First, we refer to our Elkin handbook, the Guasa handbook, where you can see for back pain and for shoulder pain, you can see this is the area that you must guasa. It's all highlighted in red. You just guasa accordingly all those areas that highlighted in red. Even you might not know how to read in Chinese, it doesn't matter because you can just refer to this book, guasa the area highlighted in red. First, you apply a thin layer of oil onto the neck area and the shoulder area, and then after that you start to even out the oil using the Elkin guasa board. After even out, use the edge of the guasa board and guasa 25 to 30 times at the same area until you can see the SAR appear. SAR red patches that you can see appear here is actually a sign of toxin in the body. When this toxin is a lot, it's blocking the blood circulation onto the body. After you do the neck area, which is where the most important area, you can start to do the guasa on the shoulder. From the hairline area, you can guasa all the way to the end of the shoulder, as you can see from the video here. Guasa 25 to 30 times using a strong force but slow. So you can guasa from here, guasa until you see the red patches. After you do on the left side, you can do the guasa on the right side. Do the same thing, apply a thin layer of oil and you guasa 25 to 30 times until you see the red patches appear. So once the SAR appear, you can see the relief is much better. The person will feel the relief much better. Then refer back to the book, you see that you must also guasa both hands. The hand, these are the 2 points that you must do the guasa. One is near the elbow, and another one is the point where Professor Lu is pointing. So first, you apply a thin layer of oil and you guasa this point about 25 to 30 times using a reasonable force. So after that 25 times, you guasa this point as well. So after guasa on the left hand, you can do the guasa on the right hand using the same point, because the meridian point are symmetry. If it appear on the right hand, it also appear on the left hand. So both hand you must also guasa. Put a thin layer of oil and start to guasa about 25 to 30 times until you can see the SAR appear. If the SAR don't appear, the person might also feel relief. But if the SAR can appear, it's even better. So you can see this here, the SAR appear. So that means the toxin already come out. See? So next one is to guasa the next point. These are the points that you must guasa. So put a thin layer of oil and start to guasa this point for 25 to 30 times using a reasonable force downwards area, and just guasa until you see red patches appear. Then for shoulder pain, these are the shoulders that area that you must guasa. Put a thin layer of Elkin guasa oil, even out the oil, and start to do guasa 2 finger from the backbone, 2 finger distance of 2 finger from the backbone area. Then you start to do guasa downwards about 25 to 30 times. So once you do guasa, you can see the SAR start to appear. The red patches will start to appear. Once the patches start to appear, the person will feel the relief because blood circulation start to move in. Then once you guasa the shoulder blade, these are the shoulders, the joint area, the shoulder joint area together with the arm. These are the area. Put a thin layer of oil and you guasa. If this area is blocked, normally you can't lift your arm, and then normally the shoulder and the arm are very painful, and sometimes the hand you can feel numbness also. So once you guasa 25 to 30 times using reasonable source downwards area, you can just guasa. You can see now the SAR start to appear. Then these are the backs. After doing the back, you can do the SAR for the front. Do the guasa for the front. Put thin layer 25 times, reasonable force, downwards, and you guasa. Then after that, you push the whole guasa to the arm, downwards area or towards the finger area. So just push downwards 25 to 30 times until you can see